Hey guys, welcome back to another episode of Unmasked Health. I'm Shelly, your host for today's episode. I am going to this is the first episode of a small series about sexual health in men, sexual problems in men, sexual questions that men may have, what men want women to know about sex as it relates to them. And I felt it was necessary that we kind of open up the first episode with what bothers men the most about sex. And what I've gathered from talking to a few men and in research is that it's the performance side of sex. What happens when, the man is, are the sexual lovers, and what happens when things are not functioning like they're supposed to. They don't work the way that you want it to. It's not working at all. So we're going to kind of open up with erectile dysfunction. There's a myth kind of about that it only affects older men, and that's not true. There are a small percentage of men between the ages, less than age 40, that are affected by erectile dysfunction for various reasons. But what I'm going to start with are myth busters. And the reason why I felt like it was really important to start with myth busters about erectile dysfunction, there's just so much misinformation out there. And if you are a man who is struggling with erectile dysfunction, you are going to be doing all the Googling, all the, asking questions online, looking at forums, listening to people on TikTok, finding people that you think you can trust on Facebook, XYZ. And they're just going to be throwing a lot of things out there. And not always is it going to be not the truth. I mean, people don't, in my opinion, generally people do not seek out to lie to people. But there's just so much information out there, and a lot of it is misinformation, and it just causes more confusion in the male population. So let's just start with some myth busters. And the first one is, if a man can get an erection, he doesn't have erectile dysfunction. And that is false. There are many cases where a man is not able to get an erection at all with stimulation, with, talking, you know what I'm saying, what men go through to get themselves ready for an erection. And some people believe that if a man is able to get an erection, then he does not have an erectile dysfunction. But many men who get erections, but they're not able to maintain an erection, can have erectile dysfunction. Or, and this is a big one, your erection is not sufficient enough for intercourse. So, I mean, just to be frank about it, it somewhat comes to attention, you somewhat have an erection, but it's not firm enough to penetrate, or it's not firm enough to, carry out the process of sexual intercourse. And that's kind of where I wanted to start with, that even if you can get an erection but cannot maintain an erection, or your erection is not, firm enough, that is considered erectile dysfunction. Number two is erectile dysfunction reflects only penis health, and that is astronomically false. If you've listened to any of my other episodes, you should already know that. I've educated a little bit on that, but let's talk about it again. You can have underlying undiagnosed conditions like hypertension, high cholesterol, depression, low testosterone, which can lead to erectile dysfunction. Remember, your penis is fed by many cells, including blood vessels that carry the blood. And if you have hypertension, or you have high cholesterol, or you have diabetes, it damages those blood vessels, so it decreases the blood flow to the penis. What if you have no physical ailments? So what happens if I have a patient that comes in, I screen him for things, diabetes, high blood pressure, high cholesterol, depression, and all of that checks out. Well, what happens if he doesn't have any of those physical ailments, but he still has erectile dysfunction? And I think that, let me back up a little bit. If you don't have any physical ailments like high blood pressure, diabetes, high cholesterol, etc., and you're still having trouble with erectile dysfunction, the next thing that I would do on a patient is to check his mental health. Are you depressed? Are you excessively stressed at home, at work? that's just if you're checking out physically, then I need you to go back and talk to your healthcare provider or reach out to a mental health specialist and talk about your psychological health. Talk to your doctor about that, your provider about symptoms, and when you seem to notice your ED symptoms the most, is it more after you've worked all day and you've had an extremely stressful day? Is it, did you experience a death in the family and it brought up, 5 years of losing family members? That's just a vague example. The other thing, is men want to know how you treat it. We've kind of busted some of the myths. There's even myths out there that wearing too tight of underwear can cause erectile dysfunction. That's just not true. But now we know we have erectile dysfunction disorder. We know that there's something going on. You've had your, physical exam. You've had your psychological exam. Those things have been ruled out. So now what? Now, how do we treat it? Well, there's a pill for that. That's what you're going to hear most often. There's a pill for that. And yes, in most cases, this is another myth, kind of. Yes, in most cases, 95% of the time, the answer is going to be yes, that there's a pill that can treat your erectile dysfunction. But what happens when those pills don't work? Then what? Well, there are other treatments. This is going to make most of the men listening to me right now cringe, and I apologize. But there's other treatments besides pills, besides injections, that kind of stuff, like testosterone injections, those things. You can actually get penile injections. That's true. It's true. There's medication that can be injected into the penis. There's several on the market, few on the market, but the purpose in those, the way that they work is they relax the muscle tone of your penis, which increases the blood flow. And now I know that sounds horrible. Putting a needle near your penis is like cringe-worthy, but the consensus is that most men say the injections don't hurt. Another myth is testosterone is the cure-all. Absolutely is not. It's not a quick fix for everyone. And we as healthcare providers want your testosterone within a certain range. Usually, like when I'm treating a male, usually what I try to do is keep them around 800. But normal blood testosterone, normal testosterone is usually between 300 to 800. So what if yours is around 400 and you start testosterone therapy and nothing changes or it's barely changing? Well, you need further treatment at that point. So you go talk to your healthcare provider about what else could be going on or what other treatment options there are. Testosterone should be used under the guidance of a healthcare provider and never used as a money gimmick for clinics. I've talked about that before. There are clinics out there that are reputable, that have spent their career studying and know all about it, even more than what I know, that are trustworthy. But there are places out there, these quick pop in and out places that are just there to get your money. So if your healthcare provider is not testing you regularly, like your lab works, your prostate, your PSA, which is your prostate, your CBC, which checks your blood levels and all that stuff, you need to find somewhere else to go. If you are seeing somebody and you are going into these places or, a clinic, your healthcare provider, whatever, and you go in and you're telling them, hey, there's something wrong. I still don't feel any different, maybe a little bit different, but not a whole lot. And they're just not listening to you. And they just say, well, let's just increase your testosterone dose. I'm going to need you to go somewhere else. It's just not worth your health. If somebody is just wanting to increase a medicine that is not already working efficiently or at all for you, at any rate, we're going to talk more about treatments. And I know this is so mundane at the beginning, but it is what it is. Research proves it. Research shows it's effective. It does help. Now, I'm not saying this is the only treatment, but this is how we get started. Regular exercise increases blood flow and natural testosterone. And if if I have some of you out there that are more holistic, then this may intrigue you more than it would others. Healthy foods like lean meats, fruits, vegetables, your omega-3 fats, decreasing your body weight. We've talked about that before. You need to limit or stop the alcohol intake. And improve sleep. Poor sleep raises our cortisol, which is our natural steroid in our body, which lowers testosterone. A big one is treat your brain. Your brain is the biggest sexual organ, and your mental health directly affects your performance. So how can we do that? What does that look like? Cognitive behavior therapy is a big one that's holistic, readily available. You can, cognitive behavior therapy has been shown to reduce performance anxiety. That's music therapy, reading a book, something like that, that can kind of retrain your brain to focus on that kind of stuff and not just the nuances of life all day long. And then you want to make sure that you don't have something like depression. There's nothing to be embarrassed about to be screened for depression. You need to see your provider for that or a mental health specialist. If it is depression, if you are positive for depression, there are other things that you can do besides the medication. Again, it goes back to the cognitive behavior therapy. You can attend regular therapy sessions with a mental health specialist and, kind of get your depression under control that way. There are medications, lots of medications out there. We all know about the little blue pill, the Viagra, Cialis, there's Levitra. We know Viagra is the short acting one. Cialis acts a little bit longer, but the purpose of these medications are to increase the blood flow to the penis. There are some tips on medication use, but again, refer back to your healthcare provider that is prescribing these medications. I'm just giving you some overgeneralized, tips on how this medication can be best used. I tell my patients to take it 30 to 60 minutes before they expect sexual activity. It works best with sexual stimulation, and I'll let you figure that out on your own. But you never want to combine any of this with nitrates like nitroglycerin or blood pressure pills because these pills are vasodilators. And so if you're taking a nitrate or you're taking a blood pressure pill at the same time, it can really lower your blood pressure medicine. Lower your blood pressure, which can lead to a whole lot of other mess. Then we have testosterone, of course. Testosterone replacement. It can increase your libido, your energy, your mood, even your erection quality. To me, the most accurate, efficient way to get your testosterone is through injections, either weekly or bi-weekly, depending on the patient, your symptoms, that sort of thing. You do want the regular lab monitoring. Too much or too little, both causes issues. And again, I'm going to hit more on the penile injections. Those injections are given on the side of the penis at like the 10 o'clock or the 2 o'clock positions. Of course, you want to avoid the veins. It works within minutes. And this is usually an option for men who are unresponsive to pills. It is not something that I would prescribe. I would refer that to a urologist to let them handle that. Urology is very, they're astute in penile injections, medication injections. But anyway, it opens up the blood vessels, it increases blood flow, it kind of traps the blood in the erectile tissue, which improves the firmness of the erection. It works within 5 to 15 minutes. It can last 30 to 90 minutes. Typically, it's not used any more than 3 times a week, at least 24 hours between the doses. There are side effects, of course, just like with any injection. There may be some burning, maybe have some small bruising, some small bleeding at the site. The biggest thing is you can develop priapism, and for those of you that don't know, it's an erection that lasts more than 4 hours, and that is a medical emergency at that point. And you do need to go to the emergency room if you were to develop that at any point. You develop that, you need to go to the ER. So what if, you don't want to do medications or penile injections or, that kind of thing, which I I can understand. There are lots of other therapies out there. Intraurethral suppositories. It's just a medication pellet that you place inside the urethra. It causes local blood vessel dilation, which promotes an erection. There's shockwave therapy. There are mixed opinions out there about that. You may talk to me, which I find shockwave therapy to be effective in helping treat erectile dysfunction, but I've talked to a urologist who felt like it was just crap. Um, but shockwave therapy is just sound waves. It's not like, shock, like you're going to feel like you're getting tased or anything, but sound waves which stimulate blood vessel repair and growth. And then you have the penile implants, and those who generally get the penile implants, that's usually kind of like a last resort. I've seen, patients who have a penile implant because they had prostate cancer and they've gone through chemo and radiation, and the penile implant was best for them. You may have patients who, or you yourself, may be a contraindication for you to do any of the medications. Maybe you are on a nitroglycerin every day. Maybe you're on 2 or 3 blood pressure pills a day and you just cannot tolerate, or it's not well advised that you take those kind of medications, and so a penile implant is another option for you. Um, and then you have like emerging therapies coming up, like PRP, which is platelet rich plasma. And the PRP therapy, there's several key physiological improvements, like it helps to develop new blood vessels, it repairs and regenerates nerve endings, it increases blood flow, it increases the firmness and the sensation and your overall performance. The men who get the PRP therapy, they report a lasting effects of 12 to 18 months. But it can be expensive. It's 1200, anywhere from 1200 to 2500 per session. So those are just some highlights of therapy, therapies, treatment options for erectile dysfunction. My main goal was to kind of highlight the myths out there about erectile dysfunction. And, there's not going to be a magical pill for everybody that's going to work for everybody. There's going to be several of you that are going to Google or going to get on there, YouTube. You may follow somebody on YouTube, you may follow somebody on TikTok, Facebook, what have you, that claim to be, this healthcare provider, or they have all this success in treating, their patients with some kind of herbal treatment over the counter, a vitamin D and whatever. My opinion is, and I always tell my patients, do your own research, but do it from reputable web sources, PubMD, that PubMed, that kind of stuff. But find you a healthcare provider that you feel comfortable with, even if that provider may not be the most astute provider in treating, like, for instance, low testosterone. Find a provider that's willing to learn and wanting to know more and wanting to do the research along with you. It's all about what you are comfortable with doing. There's not going to be a lot of you that are going to jump on board and do the penile injections, and I get it. And I know that, I've talked to urology about penile injections, and, and all the patients that he performs, or he has the patients perform penile injections, he does train his patients to inject their own penises. They have great success with it. And that may be an option for those of you who are not candidates for, like, the Viagra, the Cialis, those sorts of things. But just know that there are reputable people out there that want to help men improve their sexual health. And men, again, I'm going to hark, it is your responsibility to go get your checkups every year, every 6 months to a year, at least yearly. Get your fasting labs done to check for things like high cholesterol, diabetes. We could throw the whole book at, treating erectile dysfunction, and then you get down and you've gone through everything and it's still not working. And somebody finally checks your blood, or you finally agree to that. And then all along you've been a diabetic, and we've just, we've caused more damage than good. So, you do your research, and find the people that you trust the most. Even if it's a friend, a friend can direct you to the right people. Word of mouth goes far in the healthcare community. So if you're hearing somebody drop somebody's name, this is who I go to, this is who I see, they've helped me the most, then go give it a try. It may not be for you, but it may be. Don't be scared to talk about it with people. It's such a stigma anyway for men to have to come forth and, say, hey, there's something wrong. I'm not able to perform. My wife is frustrated. I'm frustrated, whatever. The first step is to go out, go to the doctor, go to a clinic, go to your healthcare provider, take the time out of your day to go do that. It's once a year. At most, if you are started on testosterone injections, what I do is blood work every 3 months. I do have my patients come in to the clinic and get their weekly injections just because that's just how I prefer to practice, is to leave the medicine there and let me do it in the clinic. At any rate, I hope that I've, busted some myths wide open on erectile dysfunction for some of you that are, researching and Googling and whatever. If you have any questions or you want to talk about any of the myths that you've heard, or you've tried some off the wall treatment, tea tree oil or something like that, or, standing on your head for 20 minutes, I'm really joking about that, but I really would be interested to know what treatment options you have done at home, or at the advice of others, or what you have found on Google, to help, treat this for you, your erectile dysfunction or your low sexual performance, and it either worked or it didn't work. Again, my email is Unmasked Health. It doesn't have ED on the end of mask, no pun intended. But it's unmaskedhealth@gmail.com. And next week, we're going to go more into sexual health, sexual performance, and what you as men expect or looking for, or, those sorts of things. And my email is wide open for suggestions on what you would like for me to hit, what topics you want to hear, what questions you want me to answer. No question. Now, I can't say every question will be answered. It depends on what the question is, if I'm able to answer it. But I will leave you anonymous also. That's just, unless you just want to be, your name to be out there. But I have talked to several men that I don't drop their names here. So anyway, I hope that y'all have a good week. And until next week, stay unmasked.